Today, I would like to share 10 key lessons from a podcast episode on brain health. Think of these not as rules, but as levers, changes that over time have a meaningful impact on how the brain functions and ages. Lesson 1: Sleep is one of the most important levers for brain health. Sleep is not optional maintenance, it is active brain care. Short sleep, especially under 6.5 hours, and poor quality sleep are linked to higher dementia risk, along with worse mood, focus, and emotional regulation. During sleep, the brain consolidates memories and activates its cleaning system called the glymphatic system, which clears waste that builds up during the day. A good place to start is consistency. Keep a regular sleep and wake time all week, including weekends. In the morning, ask yourself, do I feel rested and how many hours did I actually sleep rather than lie awake? Lesson 2: Quality matters just as much as hours. 7 or 8 hours in bed does not always mean restorative sleep. Ask whether you feel refreshed on waking. Do you dream? Can get through the day without a significant energy crash? If sleep quality is off, talk to your doctor to rule out obstructive sleep apnea. If you have chronic insomnia, which is trouble falling or staying asleep, consider cognitive behavioral therapy for insomnia. Lesson 3: Respect your body clock. Your circadian rhythm thrives on regularity. Trying to catch up on sleep on weekends often backfires and can disrupt blood sugar, mood, and energy. Daylight is one of the strongest signals for setting your internal clock. Aim for daylight exposure during the day and keep sleep and wake times within a 1 hour window. Lesson 4: Food timing matters. What and when you eat influence blood glucose, blood pressure, and inflammation, all foundational for brain health. One powerful habit is finishing your evening meal 3 to 4 hours before bedtime. This alone can improve sleep quality and glucose regulation. Lesson 5: The order in which you eat affects your glucose response. Eating protein first leads to a gentler rise in blood glucose than eating carbohydrates first. At meals, start with protein such as meat, fish, eggs, or tofu, then vegetables, and finish with starches, if at all. Lesson 6: Fewer eating occasions mean fewer glucose and insulin spikes. Many people eat over a 14 or 15-hour window each day. Consider shortening your eating window to 12 hours or less. This will increase your overnight fasting interval. Before snacking, pause and ask why you are eating. Is it hunger, habit, thirst, stress, or boredom? If it is not hunger, try water, tea, or a brief walk instead. If it is hunger, review your protein intake at the last meal. Inadequate protein but excessive carbohydrates makes you hungry sooner. Lesson 7: Movement is medicine, so start where you are. The best exercise is the one you will do. Walking, housework, gardening, and standing all count. Medical guidelines recommend 150 to 300 minutes per week of moderate activity. Moderate means your breathing and heart rate are noticeably elevated. You can talk but would find it difficult to sing. A simple strategy is adding short movement after meals. Even 2 to 10 minutes of walking improves post meal glucose. Lesson 8: Being less sedentary matters, even if you exercise regularly. Long, uninterrupted sitting increases inflammation and blunts workout benefits. Break sitting time by walking during phone calls or using a sit stand desk. Lesson 9: Mind body practices activate the relaxation response. Meditation, prayer, Tai Chi, Qigong, or mindful walks in nature should slow breathing, lower heart rate, and often reduce blood pressure. Even 1 to 5 minutes can help. A simple habit is taking 3 slow breaths with long exhales after your morning coffee or tea. Lesson 10: Right supplementation. A few nutrients especially relevant for brain health are omega-3 fatty acids, B and D vitamins, and iron. All of them can be measured through blood tests. Most people need appropriate supplements to meet their needs. Food alone is rarely enough. To close, choose one small step this week from sleep, one from food, and one from movement. Aim for habits that have high impact and are doable. Over time, these small changes compound into better long term brain health and potentially prevent dementia,